Okay, hello everyone. I'm Pratap Pandya. I'm a clinical associate at the Cleveland Clinic, and I'm also a social media ambassador for the Critical Care Cardiology. And we have a special guest with us today, who has spared a few minutes for us from his busy schedule, Dr. Jason Katz. Thank you so much for joining us.
Oh, thanks for having me. It's a pleasure.
Yeah, I really appreciate that. Dr. Katz is, of course, a great personality we know in the field of critical care cardiology, and he's at the NYU. Langland, now, the question I would have for you is, how do you see I know you answered part of it already, but how do you see the research opportunities in this field for upcoming trainees to look up to and, who wants to build career in this field and also get into the cardiology and critical cardiology eventually?
Yeah, my first response was long-winded. I apologize for that.
You're fine.
One other thing I love about the people that are either in the field currently or interested in the field is how curious everyone is. I mean, we have a group of interested collaborators and partners and friends and colleagues that are just curious. And on top of being curious, they're also very interested in changing the way we practice medicine. They recognize that we take care of a high-risk patient population. And, if your glass half empty, you could say, well, we've not moved the needle in critical care a whole heck of a lot. It may be hard to change the care of these patients. Critical care trials in the past have been largely negative or neutral. On the other hand, I think we have a very curious group that's optimistic that we can change things. And again, the nice thing about this field is curiosity is the most important thing. There are opportunities to study patients and try to understand the landscape and the heterogeneity in care. That can be done with single institution descriptive studies, case series, case reports, multi-system observational studies. All of them are important to our field because they inform our field. They are not necessarily all practice changing, but they're the type of studies that are necessary to generate hypotheses that then we can test in larger prospective studies and clinical trials. And it's hard. It's hard to run clinical trials in critical care populations. You and I could talk about this for probably several hours about the challenges and opportunities in running particularly randomized clinical trials in critical care populations. But they're happening. They're going to happen. And we need all sorts of research to ultimately inform those trials and the trial design. And so I think it's a great field for people that are curious investigators at young and old ages, because there's so many questions to be asked and answered. I sometimes joke, I feel persecuted sometimes by how many questions that I get, pop into my head when I'm rounding in the cardiac ICU. That's a great thing. If it stimulates research discussions and opportunities. It's a challenging thing if you just feel overwhelmed by it. But to be young and to be curious in our field is so great because there's so much opportunity. And so, again, this was the theme of our discussion today, but I'm optimistic about research opportunities, research endeavors, the opportunities for mentorship between young and old cardiologists. I think the great thing about our field is that there's a real community, and we work hard, we play hard. There's a real community around academic and research pursuits too, and so I think people who are interested in studying aspects of this field can find partners and mentorship very easily.
No, that's definitely some great words that you mentioned about. I mean, of course, with the talking about the research and trials, the danger shock with that coming up, it's really opening a lot of doors. How the research is advancing in this field now, even with the randomized trials, and that's really great. And one more comment: I don't see you as old at all. I think he's one of the youngest. At least in the mindset point of view, at least that's something I've noticed, and I really appreciate that. I really look forward to it when I become that senior at some point. I want to stay young from my mind and be that energetic that you show.
I find a lot of inspiration working with people that are earlier in their careers and younger, and it's a two-way street. Mentorship in particular is very much a two-way street. I hopefully provide something for those that I'm mentoring, and I know the mentees provide a lot of inspiration and ideas and collaboration for me that keeps me going. I mean, there's a reason that I stayed in academic cardiology. I'm sure that this resonates with a lot of academic cardiologists. It's that that opportunity to partner with young, energetic, and curious people that keeps us in the field. And so thanks for saying that. A few more gray hairs than I have had at prior ACC meetings, but I'll keep staying young best I can.
Sure.